Kia ora koutou, welcome everyone to today's fourth in our Poutama Ara Rau Research Seminar series for this year. It's seminar series I'm proud of. So Poutama Ara Rau is one of the University of Otago's research themes. It's co-led by Karen and Te Tumu and then Suze Poutama from Otago Christchurch. So as Poutama Ara Rau, we're really interested in discussions across the whole of the University of Otago on how we can each think about incorporating Mātauranga Māori into our teaching. We're really interested in that teaching-led research component and how we can share our research and inspire one another to create something really tangible here at the Otago way for engaging with our learners in the tertiary context in our classrooms. That particularly makes sense to our Māori students. Kia ora, thank you very much for joining us for the seminar series, and thank you, Jo, for presenting this seminar. As I said before, I'm really interested and really feel quite privileged and honoured to have this opportunity to get an insight into the enormous amount of mahi that you've been doing here at Otago and really helping to create a systemic change here. And I know many other professions within the University of Otago will be looking closely at what you've achieved, including the faculty. So kia ora, Jo, thank you.
O kia ora no tātou, e ngā mana, e ngā waka, e ngā reo, e ngā karangatanga o te motu. Tēnā koutou, kia ora no tātou katoa. Ko waiau, ko tūtoko te mauka, ko makawhi o te awa, ko kaitahu ka te mamoi me waitaha oku iwi, ko ka te mahaki te hapu. No te tai pautini o te wai paunamua hai, ko Joanne Baxter tōku ingoa. Well, kia ora everyone, and thanks for coming along and participating in this korero. And as Jacinta pointed out, Poutama Ara Rau is a collective of Māori staff, researchers and people who are really interested not just in what we do individually, but actually how we as a collective can come together and share what we're doing and potentially influence more broadly, not just our own spheres, but other people's spheres, as well as what I've found very much as a Māori academic staff member in this institution, the really important collectivity that we have across the institution, I think is one of the strengths of Otago. So I want to acknowledge Poutama Ara Rau, and I also want to acknowledge as I start this korero is the wonderful team that I work with in Kohatu, the Centre for Hauora Māori, and also in particular the Māori Health Workforce Development Unit, and more broadly the Māori staff and others who support and work with Māori students as they journey into, through and out the other end of health sciences. And by health sciences, I'm thinking the whole broad range of things that we do. So I'm about to dip into a range of things that we do, knowing that I have a trouble wood for the trees thing, and anyone who works with me will know I struggle with that. So bear with me, because this is something that is I'm really passionate about. That's the wrong one. So what I want to do is just give a bit of a context to what we're doing here, talk about the Māori Health Workforce Development Unit and its programs and our outcomes thus far, and in amongst it I'll weave in some of what we've been doing in terms of research along the way. I want to highlight some of our key learnings and then the direction of travel that we're taking. So it's a little bit about what we're doing, how we're doing it, what we're learning about what we're doing, and then where we're headed. And although I'm up here, I'm using the we because the we that we're talking about is a whole pile of people, and I want to acknowledge those people as I go. So I've told this, another tale for this could be a tale of two inequities. And those inequities are the inequities that we know Māori face in terms of education and in health. So what that means is that we're working at the interface of two really key areas from a Māori outcomes perspective, which means that we have double the challenges and double the opportunities. And certainly I think when I look at the team that works on this, these are people who are passionate about Māori education, passionate about Māori health and many passionate about both. So the idea that we could actually demonstrably make a difference that influences and impacts on both of these sectors at the same time is something that's really exciting to me as someone who is a public health physician. So I'm a specialist public health medicine physician. I have a commitment to Māori health and being able to influence some of the key determinants of health, including education, as well as supporting health outcomes. This is a really, really great opportunity from that Māori public health perspective. So what are the drivers of inequity that we're talking about when we're thinking of tertiary education and health? And there's clearly structural drivers, and we think about the economic position and the relationship between educational outcomes and socioeconomic position. That's a big one. Then we have institutional drivers, and that includes things like the educational sector outcomes for Māori, the likelihood that Māori will or won't attain university entrance to be able to even enter the institution. And then about subject preparation, and if we're thinking about health sciences, obviously a secondary school participation in science is part of that. And then we also have some of the other biggies, the affordability of education and tertiary education, and who are our tertiary institutions and which ones are really foster and support and allow Māori youth to thrive as young Māori. And what we tend to see when we look at the university sector and papers that have come out of health, the Mirror on Society papers still suggest that overall, although we've had some reasonably big shifts recently, tertiary education in health sciences is often a privileged education distributed on the basis of ethnicity in terms of if we look at where things were up until relatively recently. And so what are those drivers? And we see this in terms of socioeconomic position, and these are Māori children and non-Māori, non-Pacific children and the households they grow up in and the level of deprivation. So young Māori are growing up in areas of high deprivation on average. And then we see likelihood of gaining UE. And again, this is data's a little bit old, but it doesn't look too much better. And we see Māori students tend to leave school. Very few Māori students are leaving school with university entrance, only just over 1 in 5. And that's very, very different for non-Māori students. And then we have this thing of where do your kids go to school? So not only do we know that low decile schools are disproportionately Māori and Pacific students. So if you look at decile 1 to 3 high schools and you look at the ethnicity, they tend to be disproportionately brown students. We also know that within each of the schools, based on decile, Māori students in those schools are less likely to leave with university entrance. So we might say, let's see if we can shift where kids are going to school, but also that still doesn't address that particular gap. So you can see in that education space, we've got multiple gaps occurring. So what does this look like downstream in terms of the health workforce? And what we see is that although Māori make up 15% of the population, 25% of children, and about 20% of the age at which we would have young people in university, the doctors, we've got about 493.3% of the medical workforce is Māori, and dentists are sitting at a similar rate, nurses slightly better, midwives slightly better still, but still nowhere near where we should be if we were to take into the proportion of Māori in the population, let alone taking into account that we have mortality rates that are twice as high and morbidity and higher morbidity. So if we were going to factor in need, then obviously we would need a lot more. So what are the implications of this? And we're getting back to that tale of two inequities. What about the choice of where people choose to work? And if we start to look at this thing they call the inverse care law, we say very clearly, this is GP, so GPs per population, and we see that in Auckland, the numbers of GP, in Auckland Central, we have a much higher proportion of GPs per population than we do in South Auckland. And you would think on the basis of need that those two figures should be the other way around. When we look at dentist distribution, you can see that the proportion of dentists in a population is directly inversely proportional to the proportion of Māori in a population. So we look at Auckland Central, 101 dentists per 100,000 population, Tairāwhiti, 30 dentists per 100,000 population. So again, you start to get a feel for the multiple inequities and the layers of inequity building on each other. And then what are the benefits of the Māori health workforce? And if you flip it on its head, what have been the challenges in not having Māori as represented in the workforce as we have in terms of population and based on need? And one of the things is who's in there with that real commitment to Māori health. And I just want to focus on this, and I remember Paparangi Reid pointed this out to me one day in a talk, and she said, what's the difference between involvement and commitment? And on a plate of bacon and eggs, the chicken is involved, but the pig is committed. And I think that when we're thinking about Māori health and we think about the roles that Māori have in the health sector, then that additional level of absolute commitment to what is it that we're trying to achieve is sitting there. And with few Māori there, so it's not that other people don't have a commitment, but perhaps that real skin in the game may not be there for them. So we've missed out on that. What has been the implications of that? Then we have missed out potentially on Māori influence and impact in the health sector. And we also have stories coming out of qualitative and other research about isolation and high expectations on a few people. And this came out of a piece of qualitative research relatively recently. I'm usually the only Māori on the team. I'm always the only Māori doctor. Everyone expects so much, but I'm still training. And so again, we're heading into a world, and we've been in a world where there's been real challenges. And if we want the world to look different, we've got some hard yards to row. So the benefits of a strong Māori health workforce include having Māori participation and leadership across all parts of the sector. It allows for increased capacity for Māori-led health provision, increased access to culturally responsive services, Māori workforce in areas where there may be high Māori health need, strengthened cultural competence and service delivery, and a whole range of other areas. And certainly our observation with growing numbers of Māori students coming into medical school is that just by osmosis, by the presence of those students, we see some real shifts in positivity in the people around them. So the presence of Māori in a workforce makes a really, really big difference, and we're starting to see some really positive outcomes because of that. So what would the gap look like if we were going to put some numbers on it? And so we did some sort of thinking, and if I was to wave a magic wand and say how many more would we need tomorrow in order to have 20% of the workforce being Māori, we would need 13,000 more nurses, we would need another 2,800 more doctors, another 380 dentists, and another 320 midwives, and we could keep going through all the professions. So when we think about growing Māori pathways into and through health sciences, and we start to say, should we aim for the proportion in the population, what we're really saying is, should we aim for enough so that the workforce reflects the population, in which case our starting point is not, our end point is not the 20%. That's our starting point. And so we are on a journey to get to the starting gate. We've got a ways to go. So exciting, we're almost at the starting gate. I want to tell that story. But it's exciting. So health sciences, and coming back to that thing, we have 7 schools, over 6,000 students, and a whole range of really amazing opportunities in health. We have the biomedical sciences and the School of Biomedical Science. We have a new Bachelor of Health Science. We have biomedical science. And then we have all of our health professional degrees, including some that people don't really even know too much about based here because they're based elsewhere, like radiation therapy. And then we have postgraduate offerings. So what was our story, and how did we, what was our starting point? And if I start with health sciences first year, which is this really challenging first year, I'll talk about the Health Workforce Development Unit. Prior to 2010, less than half of Māori students who were studying in health science first year were making it into second semester having passed all papers. So I'm not saying they left university. Many people went on to do really awesome things, but from a health science first year perspective, they need to pass all 7 papers to apply into a health professional program. We were losing over half by mid-year. What we knew when we started to look at the backgrounds of the students is that many of the students that we were having in health sciences, first in family to come to university, many had real gaps in their science preparation. So if you know, the ideal background for health science first year is chemistry, physics, biology, 2 level 3 and at least 14 credits in each of those, as well as maths and an English rich subject. So really high level science in order to hit the ground running and be able to do well in health science first year. And also a lot of our students were coming from low decile schools. So again, looking very different to the average population. So again, not all the Māori students look like that, but this is an on average picture. And what did we know about science attainment? And this is looking at some data we looked at recently, and I'm just going to focus on the red there. But only a quarter, in 2014 and 15, only a quarter of the Māori students who were undertaking health science first year had met those ideal requirements for tackling health science first year. So it starts to give a bit of a feel for the context. If we want to move those stats, we want to end up down the line where we've got a health workforce that looks different, then we've got some real challenges sitting in this space, because you've got a big block of outcomes. So we decided we were going to tackle this in 2010, and over 2008 and 9, a lot of work had been done to build a partnership and relationship between the university and the Ministry of Health, and I want to acknowledge the Office of Māori Development, Funding and Planning, the Ministry of Health come together, and as part of that, a lot of thinking was about how can Otago better support the vision for the Ministry of a health workforce that is more representative of our population. So I came on board in 2010 as the Associate Dean Māori for the Division of Health Sciences, and one of my role was to work very closely with Zoe, who was the only other staff member at the time. And so what we did was we established the Māori Health Workforce Development Unit, and we worked to develop a strategic plan. And so the rest of this talk is a bit about what that plan is, what the outcomes have been, and then where we're headed. So our purpose was to increase Māori recruitment, retention and achievement in health sciences study, increase the number and diversity of Māori in the New Zealand health workforce and health science workforce. And so our goal was that by 2020, at least 20% of students across the Division of Health Sciences would be Māori. And that wasn't in any one specific program, we wanted everywhere. So health science first year, health science degrees, everywhere. And so given that we were our starting point was at that sort of 5%, it was a bit of a big call. This was in 2010 when we did this, but we decided to get started. And so the kaupapa that we had was that it would be Māori-led and directed, underpinned by Māori values. We ran on a clear strategic plan with program logic, targets, and a line of sight between our activity and the outcomes we were trying to achieve. So we didn't take a scattergun approach and say, oh, some people are doing this, we could do one of those, or we could do that. We sat back, we looked at the situation, we looked at the students, we analysed it, and we developed a plan. We built on the program that had already started, which was Tukahika, and then we just worked our way forward. We knew that all of the evidence about Māori education was that it had to be strengths-based, and that deficit framing, which is if we positioned our Māori students as this disadvantaged group that needed our hand because they were in some way in deficit, was not going to work. We had to have high expectations. We had to turn around and look at ourselves in an institution and say, how come our institution has so failed Māori that Māori students, who are amazing students, have done so poorly? And so we have been like Rottweilers with language. We don't allow deficit discourse in our office, in our framing of students, and we kick back really hard to any programs or services that will try and reframe Māori students in a deficit way. And so the odd person has been on the other end of that. I've been accused of, isn't that political correctness gone mad? And I said, absolutely not. This is good educational theory and we're sticking to it. So we have a strong social justice agenda with equity targets. So over the course of time, we run 4 programs. I'm going to focus on the later ones, partly in the interest of time, but talk about each of them. So we have Te Ara Hawara, which is our outreach recruitment programs for years 9 to 13, and wonderful Sam Feeney there's our lead on that, and Tukaika, which is our foundation year scholarship program. I'll talk about this. Then Te Whakapuawai was the program we implemented for Māori Health Science first year support program, and then Tutto EDA Hawara, which is a health science degree support program. And I'm just in the process as we speak of working with the DHBs on what's the next step and coming out the other end. So we are heading this all the way through as we speak. And our sort of catchphrase was from inspiration to graduation. And now I've got to do inspiration to graduation and beyond. Sounds a bit like Toy Story, but anyway. And all of this underpinned by research and evaluation. So we constantly quality improve everything we do. We have a really strong student voice in our programs. Lots of informal and formal evaluation has fed into this. So we're very reflective on what's working and what's not working. And this is really that kind of focus. So Tukahika, that is a foundation year scholarship for up to around 18 students from all over the country. They're interviewed in their own home, make an application. And these are students who probably need some additional time rather than hitting the ground running with health science first year. And so what we have within that group of students is often people whose science backgrounds haven't supported them to be able to undertake health science first year, or they've attended low decile schools, first in family. There's a whole range of things that are taken into account. And Zoe and another staff member will travel around the country meeting these wonderful young people and their whānau, and sometimes their whole communities, and interviewing them and identifying whether this is a good path for them. And then within that, we have the really, really tough job of picking from all of these wonderful young people which ones are going to get a place. And what that offers them is a place in one of the residential halls. They get their fees paid in foundation studies, and we have staff who are there to support them. The other thing that they have is tuakana support from all of the generations before. So we've now had over 150 Tukahika students, and the tuakana, the older students, are amazing at providing support and engagement. So it's like a whole community of learners. Then our health science first year, and in 2011 to 13, we went hard out with health science first year and implemented a range of support programs that encompassed full cohort support, group support for students, and then individual support. And we did this in partnership, and we still do it in partnership with the Māori Centre, who offer a whole lot of academic support and other things. So what we were aware of was that there was a real risk if you head off on your own and try and do a whole lot of stuff, that you can either replicate staff or be in competition with staff. So we really worked hard and still work very closely with the Māori Centre, and we're constantly in contact. And Ariana here is our current Te Whakapuawai Health Science first year person. And so it was really intensive. The challenge that we had, and what has become was apparent, was that we were getting really good outcomes from this, but still probably among the more privileged students educationally. So we applied to Ako Aotearoa, and we got funding to actually see if we could quality improve our health science first year support program. And so we got funding, and Zoe, who isn't able to be here now, she said, oh, she's here. Kia ora. So Zoe, wonderful Zoe, put the whole program on steroids. And that wasn't, again, nothing was a guess with this. It involved looking at a whole range of research, what were we learning nationally and internationally about what was associated, particularly for students who had more challenges, who had challenging backgrounds, who may have experienced less than adequate high schooling. What were the things that could accelerate their capacity to come into health science first year and do really well? And that involved things like mindset theory, goal theory, metacognition, and out of that a whole range of additional things happened. And this is, again, this isn't an exam, but it just gives you a bit of a feel for the program logic that went in behind that and the programs. And so some additional programs came on board. One was called SWOT, where we have a group of students who've done really well in health science first year, Māori students who've done well in health science first year in the previous year. And they support very early on a group of new health science first year students in a really structured way to support them in academic related and engaging and becoming part of university related aspects. And that's where some of the key messages about metacognition, growth mindset, all of those things are woven into that. We also do something that is really intensive but hugely valuable, which is to individually interview all of the Māori health science first year students, and it takes a real strengths-based approach. What are your aspirations? Where are you at? Where would you like to be? But as well as that, what might be some of the challenges that you will face along the way? And those challenges look different for different students. So the team will wrap around, and again, working closely with the Māori Centre, looking with that. And then the other side of it was to look at what on earth could we do with some of the science gaps in particular that people were coming. And so a really souped up approach to huge things like physics wānanga, weekends of physics, chemistry, and really encouraging people to take ownership of their learning, and if they've got a gap, to work hard and to fill that gap. But also, really, really importantly, in the strengths-based space, we acknowledged that they had an amazing support in each other. And so fostering whanaungatanga, the Māori values coming straight up the middle of all of these programs and being a strength, and then watching the students. Some of them really brought those strengths in, and they had the capacity to work with others, and each student brings in a different strength. So we started to bring those strengths together, and again, really amazing staff who work with the students to support those strengths. And then our final set of programs is Tutto EDA, which is once people are in the programs, we know they're really high stakes. If you go to medical school, you have to pass all things all the time. Our health professional students have a lot of pressure. You can't do well for part of it and then catch up later. You have to pass every year of everything. And so working with the students, again, that tuakana approach, helping and working with the students so that they know where they're headed, they know how to do well, and again, a range of things that go behind that, including academic support, specific tutorials, right through to being there for the students when things happen. And again, we work with students who have sometimes very challenging and difficult life events, and again, working with the Māori Centre, counsellors, we will often quickly wrap together a package of support for someone who's had a death in their parents or some other thing. So the outcomes, and so there's an awful lot there. Tukahika, and some of our outcomes are these really qualitative, and this is what we wanted from this program. And a typical quote: you're part of something bigger than yourself. Support is amazing, and everyone is made to feel like they matter in terms of the big picture. So why the matter is important is because some of the, particularly in the individual interviews, people's experiences of high school hasn't always left them with a feeling that they matter. It hasn't always left them with a feeling that they can achieve. And so having not just our staff, but actually having each other and then having the tuakana pass that message on. Hey, I was in your space and I got through. And we've seen some really, really lovely examples where students from places we don't usually get students from have come through this program and then they have opened the door and we've had more. And so we've got some lovely young men from Bluff, for instance, that this was a door for one, and it's open for others. And so this is some of our outcomes, and these are a whole lot of our tūkaheka students that are out there across a whole range of programs. Sometimes there's a focus on medicine, and I suppose I just really wanted to reassure everyone that in terms of the programs, they are everywhere. We've got people with BScs on physiology, psychology degrees, as well as health professional programs, doctors, dentists, radiation therapists, you name it. This is just coming from those tūkaheka graduates, and really, really wonderful to see the outcomes there. So that's some of our outcomes. So health science first year, and yeah, there's probably a reason why the team looks like they haven't had any sleep and they've got big bags under their eyes. So this is what's happened with health science first year over time, and this year we had 178 Māori students, so our numbers in health science first year are well over double what they were when they started. And if you can imagine that we now have our health science first year program on speed, as well as on speed with a lot more numbers, then actually some of the logistics of this is huge, trying to figure out how we resource it, fund it. We used to be able to use some rooms, but you can't fit 178 people in some rooms anymore. So really positive. And we believe this is a mixture of students becoming prepared, but also word of mouth, and a lot of focus on and positive reputation about coming and doing health science first year as well. And then what's happened in terms of entry to health professional programs. And this graph along the bottom is kind of the numbers that we've had entering health professional programs, and the different colours are what it looked like before we had the Māori Health Workforce Development Unit, and then that health science first year program, the middle colour, what the outcomes that we had from that, and then what's happened more recently with the health science first year on speed. And so we're working away on the analysis of this, but really, really reassuring to know that we've been getting those outcomes. And again, trying to sort of map outcomes. And so this is a bit old. I think we're up to 340 health professional students now across all programs. And then this is medicine, which people is probably the one that people have heard about most. And partly we have more students in medicine because that is the one that has the biggest class. But this year was the first time we tipped 20% of the entry to medical school being Māori students, which was a fantastic cause for celebration. And so what are some of the impacts? And I've just aroha to some of the people whose photos are in there, but just some of the outcomes, and I wanted to just highlight the impact. And we have wonderful outcomes in terms of leadership. So the young man at the top there, we're under leadership is Chase Glass, who's our lead Māori medical student sitting on the Māori Doctors Association. And he has done an incredible job of supporting and growing Māori leadership around in the Māori medical student space. We have Tutto, who's a dentist in Motueka, absolutely fantastic. He's a young man who came through tūkaheka and was he's our first tūkaheka dentist. We have the impact on the next generation, and I think, Sam, that's you there, with a group of girls from Southland, yeah, and Ari there, the pair of you, and from Southland Girls. And as people become aware of the opportunities, and we have more schools and more opportunities for people. And then that one at the top, the CEO update, is one of our medical students who's opening a health clinic in her area. And I think the GPs at the time, even though she was a second year, were quite keen to give her some keys already. So people looking forward to these young people coming out and working there. This was our big graduation a couple of years ago, and these young people went to DHBs across many parts of the country, and really wonderful to hear stories from them, but also from community about what it's like to have these young people working with them. So our critical success factors, and we've looked a lot at this, but certainly the Māori-led and directed and underpinned by Māori values is absolutely crucial. If we had tried to, let's do it this way, and put a bit of garnish on the side, it wouldn't have worked, but we came right up the middle with Māori values, and the research suggests that, and everything that we have learned would suggest that that's really important. The other thing that's crucial is the strength-based non-deficit framing, and again, our Rottweiler-ness over this, no, sorry, you can't use that framing and that particular thing, has really made a difference, because it's a bit like a virus. If people get a sense that people around them don't believe they're as good as everyone else, don't believe that they're up to it, then they will be contaminated by that. Whereas if you've got a strong sense of agency and belief in yourself, and people around you are able to understand what they need to ensure the systems and structures. So if you've had a gap in your education, you're not flawed because of that gap, but there's an awareness that that's a gap that needs to be made up for, and what are the strategies to do that. The working together aspects, we have a small team, a lot of students, and we could not get the outcomes we have if it wasn't for the other students, but also for the broader base around the university, in particular the Māori Centre, who are an amazing partner. We have amazing students, sense of collaboration, our belief that we should know each of the students, and again, some of the feedback we have from students about their high schools is, I went through high school, I don't think anyone noticed me, and so we want the students to know they're noticed, that they've got a place to come to, that they have a team of people who really care about them and their educational journeys, and if they have a hiccup on that journey, we don't shame them for it. We say, oh, what can we learn from this? What is this telling us about your pathway? How else could this have been done? So all the time supporting people with a sense of agency, but never with a sense of shame. And I think, again, some of that is undoing some of their experiences before. We have a clear strategic plan, as I say, project logic, targets, line of sight, iterative practice. If it doesn't work, rethink and retry. And again, I think we've all probably got quite strong design-oriented mentalities. So it will be like, didn't quite work. Okay, what's the plan? So we never beat ourselves up over whether things don't work. We turn it around fairly quickly and say, what can we do to actually make this work? So evidence-informed approach and evaluation, data, and I've spent quite a bit of time with some data lately, so I'm going to go data, and data. So we do work really closely with data, so trying to understand the individual nuances of the clusters of students we have, and are we making a difference for all students or just some, and which ones isn't it making a difference for, and therefore what can we do about it? So I just wanted to mention this unpacking privilege, because I think what we ended up doing, rather than thinking what's wrong with the Māori students, we kept thinking, what have other people had that Māori students, many of our Māori students haven't had, and what are the strategies to support people to have that? So some of that, like what does preparation for university life look like if you haven't had content knowledge in terms of sciences because your school didn't teach it or you weren't encouraged to take it. What does unpacking that privilege look like? So we turned it over, we unpacked and we repacked. And so some of our initiatives are really around what can we do to make up for some of that lack of privilege, and what are the things that we can inject to accelerate success, particularly in those early years. And then the other thing is that power of words, the non-deficit framing and non-deficit discourse. And again, really trying very, very carefully to not come in with a sense of these are flawed individuals who would never have achieved anything if we hadn't have helped them, versus this is the journey you're on, here's some strategies, here's some approaches, and of course we're there as a supportive base And so within that, and there's some subtleties in there, but we're fairly clear, and I think the evidence is fairly clear around that. So just in summary, we have this tale of two inequities. Gross inequity in health workforce and in health. I haven't gone into health stats, but we could do that forever. We have education sector inequity, which is driving our health workforce inequity, which is driving our health inequity. And so if we can crack this one, we have the capacity to reverse inequities across both spaces. We have strategies to grow the workforce. We have a lot of gains and a long way to go. But I believe, I think the call that we made to not just do what we've done, but to take the approach that we've taken, I think was a good call. Where to next? And in terms of the research space, continuing to work on our health science first year. We're now branching out into looking at the socioeconomic status. So the medical school has a new socioeconomic priority entry criteria. So this will be students from deciles 1 to 3 high schools, and there will be an entry pathway for those. And Zoe, Peter Crampton and I put our hands up to lead the development of what that will look like in terms of a student pathway process. And take a similar approach, wrapping research around it, and that will be emerging. And then the other thing for me had been the feedback from our graduates that they were hitting the DHBs, and being Māori meant nothing to many of the DHBs they worked for. And so there was no evidence of recruitment, retention, or support for those young people as they became people who work in the health sector. So I have been working over the last year with the DHBs and other parts of the health sector to look at what a project might look like, to actually look at that transition, but also what does best practice look like in the recruitment, retention and employment of Māori in the DHB sector. And that has suddenly become bigger than Ben-Hur. I should never have given a talk about it, and slightly flooded with requests on that one. So continuing to work and embedding best practice, and probably the final learning for me has been that with a lot of research, great recommendations come out of research, and then they sit there in the paper. And then later on, someone says, oh, we've got this health outcome. Someone should do some research in this. And they do it and they get the same sort of thing and they come out with the same recommendations. And so our learning was, start with the implementation as part of what you're doing, and then you can embed best practice as you go. And so the versus doing something that's over there where you go, oh, here's some ideas, guys might like to think about this. And so the work with the DHB will very much be a hands-on work as you go, versus a stepped back, ta-da, here you go, kind of process. So I just finished there. And any... Sorry. And this is my huge thanks to all these wonderful people, including our wonderful team and staff.
And our thank you to you, Jo, for an incredibly inspiring talk. I knew it was going to be, and I'll be writing down little notes around how do we turn your learnings into something that makes sense for a lot of us that we're working within our own departments here at the university, and even more broadly around calling for more Māori academics and so on. And so this whole focus on the workforce, for example, like a Māori tertiary workforce, what that might look like. There's probably lots and lots of questions, and we only have about 5 minutes. Can I just ask one question? How did you, right back in 2010, really transform that commitment and strategic into funding action?
So we were fortunate that the Ministry of Health had provided funding in particular for a range of programs, and then their requirement was that it was a partnership with the university. And so not long after we started, Peter Crampton came on board as the PVC, and the division developed a policy, a mirror on society policy, so that our graduates reflected society. And so we had a coming together of policy, and we have funding from the ministry and then a commitment from the division, which meant, and it wasn't necessarily a lot of additional funding, but there was support for our space, my time, and so an in-kind kind of ongoing thing. And then we've gone out hunting funding, the ACOL grant, we've had quality improvement grants for little pieces of what we're doing, and then we're really, really careful. So the careful line of sight between what we do and the outcomes is in part because we don't have the luxury of being, resourced to think, oh, we'll give that a go, it doesn't really matter too much. We've actually been really tight. And then I have to say, I think I get 2 people for the price of 1 for every staff member we have, and because people work so hard in that space. And so the first sort of third of the year, I don't think the team in the workforce development unit get a weekend off. There's nights, there's all sorts. So the resourcing, the outcomes are partly reflect external funding, but they also reflect huge hard work and hunting funding. Mm. Yeah. No, that's, yeah. 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 And that's what I've really struggled to. Yeah. Yeah. I think you're exactly right in terms of our kickstart came from the Ministry of Health and still does. I do wonder about whether or not that aspirational goal for Māori scientists and things, whether places like MB and some of the science foundations, so the issue is whether or not to package up a pathway for Māori in science that could be taken to the equivalent potential funders, let alone actually the university itself thinking this is a good thing to do in and of itself. But I think there is a lot of wish for Māori in sciences, but there isn't just that one place. And it might be a matter of actually pulling those groups together and saying, if we did this, we could potentially have a pathway, but we need that link with you for that. And that's what takes the time. And I think, again, trying to justify things like being able to do the kind of project work to make that happen within the lives of being an academic person, where you're expected to use your time doing research that gets publications versus hanging out with science organisations to tee up pathways for students. And so some of it, I think, is figuring out how to make it happen. I think it is possible, and I think it could be really, really exciting. Mm. Mm. Yeah. 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 Mm. Yeah. Mm. Yeah. I mean, I think it's worthwhile continuing to look at what are that opportunities, but also in that space of, you know, our students get really motivated by people who've come out the other end, but maybe not too far. So maybe there's something in that motivational space of drawing on recent graduates and looking at what stories they have to tell about their pathways and what they've got from it. That might be a useful thing too. Mm. The latest Māori strategic, yeah, exactly, and that's a great thing to end on. And just the latest Māori strategic framework separated out, and before it used to have growth and development of Māori students and staff, and so they now have one for staff, one for students. We haven't yet quite seen the implications of that, and it is a real challenge, I think, for us all as we sit here as Māori staff, hoping that one day we won't know every single Māori staff member in the university. Because there will be so many that will go, oh, versus like, oh. Anyway. So
and
thanks.
on that note, Jo, Kia ora, thank you very much for a very important talk, and I'm really pleased that you did a video to this. On our Poutama Ara Rau Seminar, that